Hello and welcome to our webinar, Anxiety in the Context of Autism, What Parents Need to Know. We are so pleased to have Dr. Jonathan Dalton as our presenter today. Dr. Dalton is a licensed psychologist who has been specializing in evidence-based treatment of anxiety and related disorders for more than 20 years. Dr. Dalton founded the Center for Anxiety and Behavioral Change, CABC, in 2011. He received his undergraduate degree in psychology from Villanova University, a master's degree in psychology from the Catholic University of America, and a doctorate in clinical psychology from Fordham University, with a specialization in child and family psychology. He completed 2 years of predoctoral training at the Johns Hopkins School of Medicine, Kennedy Krieger Institute, and advanced postdoctoral training at the Maryland Center for Anxiety Disorders at the University of Maryland. Dr. Dalton has a passion for working with individuals with complex presentations, including co-occurring chronic health conditions, anxiety disorders that have not responded to previous interventions, and youth whose experience of anxiety interferes with their ability to attend school. He is particularly interested in the intersection of neurodivergence and school avoidance. He has provided extensive training and consultation to schools and school systems locally and nationwide, and values presenting to community organizations on his areas of expertise. He believes strongly that community outreach and providing professional training is a critical part of his shared mission at CABC. Thank you for being here, Dr. Dalton. I will now turn it over to you.
Great. Well, thank you so much, Diana. It's a pleasure to be back here. I had given, I guess, the first version of this a couple of weeks ago, talking about broad anxiety, and I've been looking forward to talking about anxiety in the context of autism for quite some time. This is something that is very important to me and something that I see every day in my office, and I'm looking forward to answering questions at the end. I can talk about this for hours and hours and hours. So I know we only have about an hour for me to talk, and then we'll open it up for questions and answers. But I'll share what I've learned from the kids and families that I've worked with, and then we'll dive right into it. So number one is we're talking about autism, and autism is a really big tent. And obviously, our understanding has grown considerably about what autism is. When I was a kid, if someone mentioned autism, I would think of the movie Rain Man. Now we think about people like Greta Thunberg, tech titans, people who are having a very different presentation from someone who is needing high levels of support. And so, as we're talking about this, I want to acknowledge that there is a huge range of support needs for people who have autism. There's level one, level two, level three autism, and I have an hour to talk. So I will do my very best to do justice to everybody who shares that diagnosis, even though there are many, many differences. We now know, for instance, that 1 out of every 36 humans is autistic. And this is a really important understanding because, on average, about one kid in every classroom is autistic. When I work with my school avoiders, especially since the pandemic, we find at our center that about half, when they walk in the door, are autistic, but they don't know it, and their family doesn't know it. And it's a very subtle presentation. They are often teenagers. And we know, for instance, that women, girls have a very different presentation than guys do in the ways that they present with autism. And so we'll talk about some of the subtle presentations as well, because everyone deserves to understand their own brain. And it makes such a difference. I was talking to people yesterday who have late diagnoses and how they were sharing how much they had wished that they could have better understood themselves at a much earlier age. So just want to begin by acknowledging that there is a huge range of what we mean by autism, but it's really important that we understand how common this neurotype is as we go forward. So those of you who were here for my first webinar, well, this will be a little bit of a repeat, but it's so important that we do a foundational few minutes on anxiety and anxiety disorders. So, and then we'll talk about how there are important differences between allistic or neurotypical individuals and their experience of autism and autistic folks and how they experience anxiety. So, number one is anxiety is a really important thing for humans to feel. It is something that evolution has spent millions of years crafting within us. I think of anxiety as the flip side of the same coin as pain. Pain says, stop doing this thing, you're damaging your body. Anxiety says, don't do this thing because you may damage your body. And so, one of my pet peeves is when I get a referral for a new kid to work with, and I'll say, well, what's the issue? And they'll say, well, they have anxiety. And I will say, well, thank goodness for that, because if they didn't, they'd be in really tough shape. Anxiety keeps us safe. Think of it as nature's stop sign. It tells us not to do things that could be really dangerous for us. Like any alarm system, if it's working the right way, it's an alarm that will go off when it needs to and won't when it doesn't need to. Another thing that anxiety does, and this is really important to understand, is it prevents us from repeating mistakes. And so, if while we are doing something, we get sick, hurt, or scared, it will be stored differently in our memory. I call it, it'll be red flagged so we don't forget it and we won't repeat that thing in the future. If you ever had food poisoning after eating something that you previously enjoyed eating, you'll know the power of that conditioning experience and how our brain will remind us not to eat that thing again, even if intellectually we know that it was, a bad batch or that we had the norovirus or something like that. What makes anxiety become disordered, and even people in the field get this wrong, is not the intensity of anxiety. If you are in a very dangerous situation, I want you to be very anxious. This is a true story. About 4 years ago or so, I was chased by a mother bear in the woods. My dog thought it would be a fun thing to chase them. Mother bear didn't appreciate it. She chased my dog back. Dog came to me for protection, brought the mother bear within about 2 feet of me. I was a little bit anxious in that moment. And so that's a great thing because I wasn't getting distracted. I was keeping my eye on the threat. I didn't have an urge to go pet one of the cubs because they were cute, which they were. But anxiety is protective. So if you're in a dangerous situation, being anxious is exactly how you should be. What makes anxiety become disordered is it's fundamentally a false alarm, where the fear is real, but the danger is not. Now, the challenge with this is that if I were to, in the morning, put toast or a bagel in the toaster, go upstairs to finish getting dressed, a few minutes goes by and the smoke alarm goes off, I can never tell by the sound of the alarm if I burnt my toast or if the curtains are on fire. And the same is true when it comes to our fear. When we are feeling very anxious in a situation, we can never judge by the intensity of our anxiety how accurate our appraisal of danger is. And so we, what I call, fall back on our default factory settings as human, and we avoid and escape as a way to decrease our experience of anxiety. Now, avoiding and escaping mother bears, highly recommend that. But when we are avoiding things that are scary but not dangerous, we are preemptively firing the very best teacher we will ever have in our lifetime, which is our own experience that would have taught us that while the fear was real, the danger never was. And it leads to these critically important words of unnecessary avoidance. And in those two words lies the target of treatment, of clinical intervention, that we teach kids what we call non-avoidant coping skills. We help them to linger in the presence of their anxiety and to not avoid and escape. And then a couple things happen when someone does that. Number one is they learn that their fear was out of proportion to the danger. And number two, and more importantly, they learn they can handle the experience of anxiety. And so, in an allistic or neurotypical person, our goal is to lower their avoidance, is to help them to basically stay in the presence of the anxiety, to persist in the presence of anxiety. And if we do that, because avoidance is the lifeblood of the anxiety disorder itself, the anxiety will come down naturally. And so when I was trained, 20, 25 years ago, this is what we were talking about. And it's a highly effective intervention, but it needs to be changed in really important ways for our autistic kids that we all care so much about. So we'll talk about that. Okay, so what I tell the kids is that avoidance and fear are teammates. That if we are avoiding as a way to regulate our emotions, we are in essence encouraging the anxiety to come back around next time. I encourage parents and kids to think about their anxiety as a dog begging for food, only it's begging for avoidance and escape. Now, when one of my dogs is begging for food, it's really frustrating, and it might be tempting to say, okay, fine, here's a big piece of my steak. Now go away and never beg again. But those of us who know dogs understand that the dog will go away very, very briefly and come back and beg louder and longer. And that's what anxiety does if we feed it avoidance, which is what it needs. And again, this is the classic model of neurotypical anxiety. And I love treating anxiety disorders because they're so treatable. As an aside, we know that even 20 years ago, the average teen in America was between 5 and 8 times more likely to have symptoms of an anxiety disorder than the same age kids did during World War II and the Great Depression. So it's important that we understand how ubiquitous anxiety really is. Now, the way everyone learned this, and if you've ever, taken Psych 101, you probably have heard someone use this example. That fear and anxiety is like cool water. And in the early part of the season, the water is really cold at the beach or the pool. And if you go in, it's going to be really uncomfortable in the beginning. You're going to get goosebumps and you're going to be uncomfortable for a period of time, but not forever. And then pretty soon, it's remarkably quick actually, our goosebumps go away, even if we've done nothing to chase them away. And we get comfortable, even though the water hasn't changed temperature and neither have we. We've gotten used to the experience of the cool water. We call that process habituation. Another really important part of anxiety reduction is what's called violation of expectancy. The thing we were thinking is going to happen that we were scared of does not. And so if someone goes in the water and they think they're a little kid, they don't know better, and they think they're going to be cold the whole time they're in the pool, they're probably not going to want to go in. If they get in, they habituate, they get used to it, the goosebumps go away, and they realize that their fear of being cold for the whole afternoon doesn't happen, then they get better. And anxiety is very much like this, that you stay in the presence of it, you get used to it, and the anxiety turns into something that is different and much less challenging in that way. And again, this is our classic neurotypical allistic anxiety. However, for our autistic folks, it doesn't work that way, at least not in exactly the same way. And we'll talk in a little bit about how we can intermingle two different treatments at the same time for our anxious autistic kids. But for our autistic kids, very often it's sensory related and they're overwhelmed and they're overstimulated. And so they're not going to habituate to that. I think of it much more like if you're on a transatlantic flight and there is a screaming newborn in the row in front of you, I promise you it will not get easier the longer it goes on. It escapes the habituation process and becomes more taxing and more challenging. And so when we get a kid who's autistic, and I'll talk about this in a minute, but I think that kids often will say they're anxious, but I think that very frequently they're using the wrong word. And so they get in that situation and they don't habituate. For my school avoiders, they get back into school, but they don't stick the landing because it doesn't get easier over time. And so if you're that on that plane and you're over the ocean and you're got hours left to go, there's a screaming newborn who just will not go to sleep. I promise I know what you're going to do. You're going to put earphones on. You're going to moderate the inputs that you're receiving. And we call those accommodations. You're going to be changing your experience of the environment rather than simply trying to get used to it. And so when it comes to anxiety disorders in an allistic neurotypical child, The evidence-based interventions are what we call lowering family accommodation, because anxiety will give whatever space you allow it to. It will keep taking and taking and taking. And so we help parents to be lovingly firm, calmly consistent, to express confidence in their kids and their ability to handle the anxiety and linger and persist, and then the anxiety will reduce. For our autistic kids, we have to incorporate the very thing that we're avoiding doing for our neurotypical people, which is accommodating and helping them to have a different experience of the environment itself. This is a really, really important distinction in terms of how kids are treated by their parents and professionals when they are feeling a lot of anxiety and they're autistic. And we'll talk more about that. So I mentioned a minute ago that I think kids are often using the wrong words. So let me explain what I mean by that. So I remember, a few months ago, I was working with a teenager who is autistic, and they were new to my care, and I said, "Tell me about what you're experiencing." And she said, "I'm really anxious. I don't, I'm avoiding doing all of these things." And I asked her what makes it really hard to be in those situations, and she described things like, the sounds and the smells and how crowded the hallways are in school and how overwhelmed she feels and how exhausted she is when she's there. And so I said to her, "Well, are you anxious or are you overstimulated and overwhelmed?" And she said, "What's that?" And I explained it to her, and she said, "Oh, that definitely, it's that." And I said, "Well, you mentioned that you were anxious. Like, why did you use that word?" And she said, "Well, it's because everyone told me I was because I was avoiding doing things. So I just assumed that they were right." So let me give you a metaphor that I think kind of really sums up some of the important differences. Let's say for a minute that I have a really severe phobia of going to the dentist. I haven't been in years and years and years, and I have a tooth that's really, really hurting. And so I'm going to have a ton of anxiety. I'm going to have a lot of intrusive, scary thoughts about what if I go in, something's really wrong. I need a root canal or I need to get my tooth pulled. Because the experience of anxiety involves uncertainty. An anxiety disorder I liken to an allergic reaction to uncertainty. So the whole time I'm preparing to go to the dentist, I'm driving there, I might have fantasies about turning around or wouldn't it be nice if I got a flat tire right now? I don't have to go. All of those kinds of things. Lots of avoidant urges and really high levels of anxiety. Now, let's say I get there, my heart's pumping really fast. I'm really anxious, my palms are sweaty. They do x-rays and they come back and say, "Yep, you have a small cavity. Why don't you come back next week and we'll fill it." Well, the whole week in between, I will have a lot of thoughts about going in. I'll have lots of urges to avoid. I will not want to do it, but it's not because of the uncertainty. It's not because I don't know what they're going to do. It's because I know exactly what they're going to do. They're going to give me a shot in my gum and they're going to drill into my tooth and it's going to not be comfortable and it's going to be a miserable experience. And so it's not a violation of expectancy when you go in, it's a confirmation of what you expected, right? It's not anxiety because that is about uncertainty. This is dread. It's about I don't want to do it because I know the way it's going to be. Some of you might dread your mother-in-law coming to visit, but most of you are not fearful. I'm sure some of you are, but most of you are not fearful. You're not anxious about your mother-in-law visiting, but you're probably dreading it in a lot of important ways. And so it's really important that we use the right language. And so for many of these kids, if they are avoiding a situation like school because they get overwhelmed and overstimulated and exhausted when they're there, um, if we put them in that environment in a non-accommodated way, so we're not changing the environment, we're not going to habituate to it. We're not going to see that reduction. So it's just really, really important for us to understand the language and the differences between anxiety and dread in this population. Okay. Okay, let's talk about what the research tells us about anxiety and autism. There used to be, and this is where I was talking about the large 10, level one, level two, level three autism. I don't have time to go into all of those, but level one is what we used to call Asperger's, in the past. Um, But we do know that there are different presentations. And so language ability, autistic kids who are highly verbal, they often present with what we would think of as more typical anxiety. Those kids are really often very socially anxious, but they're anxious because they often don't know what to say or do in the social situation. I work with a guy, I saw him yesterday, one of my favorite humans. He's now graduated from high school. He's an autistic guy. And he talked about in what he termed interpretation exhaustion, that people are saying one thing, but they mean something else. And it's hard to navigate those subtle social cues in that environment. And so there's a lot of social anxiety because there is a deficit in being able to process social information. When we see people who have higher support needs who are autistic, they often present with what we call more atypical anxiety, which is a fear of sensory experiences, difficulty with transitions, um, difficulty with change of plans and plan. And so really important. So I run an anxiety treatment center, and it makes perfect sense to me about why we see so many autistic kids in our center. And so in this one study, this is 12 years old now, but over 90% of our kids, I don't like the term high functioning because I don't think it's a spectrum. I think it's more of a color wheel, but that was the term that was used in 2013. So I'm putting it here. That over 90% of these kids, I'll say, who have lower support needs, have two or more anxiety disorders. So this is a population that has very, very significant levels of anxiety. This one in 2020, the top one here, about 40% of our kids who are autistic, broadly defined, big tent kind of definition of autism, have at least one anxiety disorder. And those includes level one and level two autism. So we have to understand that if I have a peanut allergy and I work at Five Guys, I'm gonna have a lot of anxiety about being there. But the problem is a mismatch between my system and where I am, rather than a core challenge for myself. And so being autistic in an allistic world is a very, very challenging thing because this world was designed by and for neurotypical people. And so it is really challenging. Now, if 35 out of 36 of us was autistic, this wouldn't be the case. The challenge is living in an allistic world. So let's talk about some of the differences. I mentioned this idea of being overwhelmed. Worry is language-based, it's future-oriented, it can be, but not always specific, and it's much less impairing. Overwhelmed experiences is a right now. I had a kid last night in my office who is autistic, and he gave me permission to share this. When he gets overwhelmed, which he is right now, he said, you ever have that experience where like you're outside for a while and you're super dehydrated and you've been hiking for too long and you just can't like think clearly and everything just feels off? He's like, that's the way I feel when I'm overwhelmed. It's global. You can't think in an accurate way. The analogy, you can't see through boiling water. That's the way that people experience it. It's not a what if, it's a right now experience, and it's feeling based. Important distinction. Now, I mentioned before about like how do we intermingle treatment for people that have anxiety disorders and have autism. And I often think of this like untangling the fishing line to see which thread goes to which fishing pole. So I'll see many people that have OCD or another anxiety disorder, and they're autistic. Like I'll give you an example. I work with a young woman. She's autistic, although she didn't know it until unfortunately pretty recently. And she had a terrible anxiety about going into long car rides. And she was afraid of, what if I'm in traffic and I have a panic attack and I don't have nowhere to go because we're in stop traffic? Well, she also has really intense sensory sensitivities, and she will have problems with the vibrations in the car. And if trucks drive by, the sound of that really bothers her. If she is driving and there is a sun that's coming through the trees, that kind of almost like staccato, flashing that comes, when the sun's through the trees, that sets off her sensory system. And so we were doing the evidence-based intervention for the anxiety disorder. So we were doing exposure. So we were gradually having her drive more and more. And then we started adding traffic to it. So we do exposure if the fear involves what if questions, if it's about uncertainty. But we also do sensory regulation exercises. And so if the question involves uncertainty, what if I panic? What if this bad thing happens? We're going to say, all right, well, let's do that thing. We're going to violate your expectancy. You get in traffic and that thing doesn't happen. And so that's classic, the way that we were trained. It's going to reduce anxiety very, very effectively. But you know what? While you're doing that exposure for driving in traffic, you are going to be wearing really good wraparound sunglasses, and you're going to be playing white noise on the stereo to block out some of the experiences. We're going to make sure that everything in your trunk is secured so it's not going to vibrate and bounce around and set off your system. And so, as I was mentioning before, sometimes people say anxiety when they really mean dread, but very often they mean anxiety too. And so when we work with them, we're going to mix the exposure, the going on offense against the anxiety, the persistence and the presence of it for the what if questions with accommodations to help them to do it. So if I have my kids who are school avoidant, when half of those kids are autistic, we are going to work hand in glove with the school to help them to lean into the things they're afraid of. Like, what happens if, fill in the blank, whatever their fear might be. What if someone thinks that I'm weird? Or what if something bad happens to one of my parents, like separation anxiety? We will help them to persist in the presence of those things, but we're going to have them wear earphones. We're going to maybe do a reduced class schedule if their nervous system just can't handle the rinse and repeat of every single day in there. And so we're going to mix the two together. The other part of it is that the global skill of distress tolerance, of being able to tolerate it more effectively our internal experience of feeling prickly, is great across the board. And so, borrowing from what's called dialectical behavior therapy, learning some of the skills, and we'll go through what those actually are in a little bit. I call them right now skills that we can use if we feel like we're about to overflow. And so it's important that everyone understands that we do treat classic anxiety disorders among autistic individuals, but we do have to mix in accommodation and sensory regulation and other things into the experience itself. So let me tell you, again, I learned so much from the kids and families, and this was one of my autistic high school students. And when he learned he was autistic, which wasn't that long ago, which is really standard for the kids that I work with, he had a million questions for me. And he came in one day and he said, why is it so hard for me to have changes in what I'm planning? Why do I need 2 days notice if we're going to go out to dinner at a restaurant? Why is a substitute teacher such a challenge for me if I walk in, I didn't know that my teacher was going to be out that day? So I thought about it for a minute and I came up with this analogy, and it resonated with him. So I've been sharing it since. I said to him, I want you to imagine you have the world's worst job. You are working in a minefield every day, and you have to watch every single step because one false move and that's the end. And it's exhausting. The good news is you have a very detailed map of where every one of the mines is laid. So you know where they are, but it takes tremendous focus and effort in order to maintain safety in that environment. So you can imagine every single day you're going to come home depleted and exhausted. Now, one day you come into work and they say, oh, change of plans. You're going to be in a different minefield today. The problem is we only have the map for the old one. Imagine what that would do to your nervous system, because now you don't know where the minds are. Now you don't know what's going to be happening. And so that is part of why internal scripts, being able to predict what's going to happen next, is so important for autistic people. Structure, routine, predictability, sameness are core parts of how autistic people will self-regulate and navigate the world. They need that detailed map. And should the minefield change, you can imagine how distressing that's going to be. Now, let me share another example. We've all been to, well, I shouldn't assume that, but if you go to the beach, you're going to see in the back of the lifeguard chairs, you're going to read about this. There are these things called riptides. And if you're stuck in one, it's going to kind of sweep you out to sea. And everyone's instinct is going to be to swim right back to shore. But the water's moving faster out than you can swim back. And so if you try and fight against the current, you're going to end up just exhausting yourself and not really making any progress. Okay. Really, really important distinction. Now, the good news is that while that stream of water is really intense and powerful, it's also narrow. And so what you do is that you swim sideways and you get out of the intensity of the stream, and then you can come back. Now, when people are flooded, in the field people call it meltdowns. I find that pejorative, so I try not to do it. I use the word flooded. When someone's system is overwhelmed by stimulation or overload or being overwhelmed in the environment, and they are feeling that way. I see in my office on a regular basis. We are not going to engage them in the same way. We're not going to say, "What can you tell yourself when you feel this way?" Which is a great thing to say to an allistic kid. For an autistic kid, we use redirection and distraction. So I will know the special interests of every one of my patients, and I'll have preloaded, YouTube videos on my phone or something like that. And so if I see someone getting overwhelmed in my room, let's say I'll have a high school kid coming in and they are super stressed about a chemistry test coming up. They are overwhelmed, they're behind, they don't know what to do about it. Maybe they're perfectionistic, but they know they're not going to do well on the test. And you can see the stimming or the, whatever it might be happening more in that environment. I'm going to say, hey, let's say, because I have a kid whose interest is otters, like the animal. I will say, hey, I've been meaning to tell you, there's this really cool zoo I found this video of where the otters can stick their hands through these little holes in the plexiglass and you can pet them. Let me show you this video. And so I will do that, and I will bring her out of the current, have her swim parallel to shore in this analogy. And then once she gets out of that overwhelm, because now she's focusing on a special interest, then I can bring her back to shore. And so when you have a kid who is overwhelmed in that moment, this core skill of being able to help them redirect their focus to a special interest temporarily and then have them utilize skills. The other thing that I will do, I don't use the overhead fluorescent lights in my office because it drives all of my kids nuts. So I have a whole series of floor lamps. And so if I have someone who is feeling overwhelmed about the chemistry test or about an argument with a friend or whatever it might be, and I can see the autistic nervous system getting overstimulated by what's happening, one of the very first things I will do is I will stand up and turn off the majority of the lamps in the room. Now, they were not overwhelmed because of the light in the room, but lowering the ambient stimulation, lowering the volume, sometimes literally in their environment, but decreasing the stimulation visually with texture in different ways. All of a sudden, I can see their body lose some of its energy in a positive way, and the nervous system starts to calm down. So when you're flooded, you look to lower stimulation and redirect to a special interest rather than directly trying to address the kids and help them to utilize the skills in that moment. Because when I think of them as like an overflowing sink, they're not able to take anything else in at that moment. So let's talk about what kinds of things lead to this experience of being an overflowing sink, to being flooded. One of the things for kids, because kids are also students, is really important is this idea of cognitive overload. Autistic people, one of the amazing talents, well, they have many of them, including one being a really, really intense appreciation of justice and fairness. But one of the things is when people are really detailed focused, they might not see a forest, they may see 11,013 trees. And so when there are so many options, if a teacher says, hey guys, I'm going to, for a high school kid, I want you to write a persuasive essay about a topic of your choosing. That's a nightmare for many of my autistic kids because, like, well, how do I know which topic? Or what do I say? There's no rubric to follow. I don't know what to do. I was listening to a podcast and I so wish I could remember who was the one speaking, but I don't. She was an autistic adult who also was in the field, and she was giving an address in front of a lot of people. And there was a break in the middle, and so she walked back to get a drink as a refreshment. And she walked back to the table, and there were over 10 varieties of soda cans on the table. And she said, I froze. And I literally was frozen, and I could not pick one. And I was standing there like just like this. And one of her friends was there, came over, saw what was going on, and said, oh, here's three cans. Which of these three would you like? And she said, oh, I'll have that one. When there are so many choices, when there are so many details to try and analyze, when there's so many different options, it will lead to this thing called cognitive overload. When we understand the idea that the detailed focus makes them vulnerable to being overwhelmed because they're having to analyze so many variables at the same time, then we can understand why certain things like math might be easier because there is a right way to do it. Whereas if you're trying to write a haiku, well, that's easier because there's a certain number of syllables for each thing, but that's harder than math. But if it's something like writing an essay or trying to interpret what an author really means with what they're writing in that short story, that's really, really hard. So that leads to that feeling of being flooded for many of my kids. Sensory overload, very idiosyncratic. For certain people, it's chewing, or the lights buzzing, or lights flickering. A lot of my autistic kids can see the lights in my office flicker. I cannot see that. For some people, it's textures. Like a lot of my kids will not wear long pants, and if they go to a school that requires it, oh my goodness, it's so hard for them. Or when the world goes off script, when they're in the new minefield, something unexpected happens. The road is closed, metaphorically, and they have to take a detour that they didn't plan for. Those are all very common triggers for being overwhelmed. What it can look like. How do we know? Well, one of the things that I hear from a lot of my autistic kids is that people don't know it when they're overwhelmed. I often joke with them, I was doing that this week with one of them. I would never want to play you in poker because you're really hard to read. Your facial expressions don't say as much for some people. For some people, it's the opposite. But it can be increased stimming, it can be rocking. One of the ones I see a lot is pacing. It's often overlooked as one, or saying things to themselves, or rubbing their knee in a certain way. Um, Anger and refusal and non-compliance. That's certainly something that we see a lot of. But freezing is one of the things. I was working with an autistic kid this week, and she had problems going to school. She's brilliant, but she was seated, fully dressed with her book bag, ready to go to school, and then realized she couldn't. And she couldn't leave the house, even though she wanted to. And she described it like being at Safeway, having all of your items on the conveyor belt as you're paying for it. They ring it up, and you reach for your wallet and realize you don't have it. That's what she described it as, this freezing. I want to buy these groceries. I intended to buy these groceries. I cannot buy these groceries. And I didn't know it until just now. The flight response, certainly we see that. The meltdown or the flooding, um, and the shutting down is something that is a core feature of what it is that we see. And so understanding this idea of shutting down, And we'll talk in a minute about autistic burnout because it is central to understanding this phenomenon. Now, I put this one up there. I apologize, but not really. I want to help people to understand the experience of autistic people and their incredible sensory sensitivity. So these are hissing cockroaches. So not only are they awful to have on your face, they also make horrible noises. But you know what they're not? They're not dangerous. And so if you're like me, you're looking at this going, "Oh my goodness, I can't imagine being in that situation with these things crawling on me. That just sounds horrible." Well, now imagine that this is happening and you're trying to learn something that you're going to be tested on soon. Or this is happening while you are taking a test. Imagine how incompatible those experiences would be. Or imagine that you know that when you go to school that you're going to have this happen to you at random times throughout the day. Imagine how hard it would be to go to school in these situations. Okay. So these are things that, I put that on there, sorry, but not sorry, to really understand the internal experience of someone whose sensory system is really overactivated. Even though they're not in danger, they certainly don't feel safe. Okay. Let me talk about something that has gotten a lot of publicity recently. It comes out of the UK. A couple things that I'll just mention as a preamble to talking about PDA. Number one, it is not a diagnosis. You can't put that on an insurance form to send anywhere. It is a subtype that we see among autistic people. I believe that when I talk about this, many parents think, oh, my kid has this. Sometimes they're right, but I think that they often overestimate the likelihood that their kids have a true PDA profile. But it's really important that we understand this. So this is some of the information about what PDA looks like. It's kids who say something like, I could do it until you told me I had to, and now I can't do it. Dr. Donna Henderson, who's a treasured colleague of mine and an expert in autism and PDA, she was talking to me once and she said how she was trained in this by an adult with PDA. And that adult said that being in control, feeling in control for this person with PDA is as important to them as a new baby is to a new mom. And there is nothing that you could say to that new mom to have her hand over that baby to a stranger who just walks away with it. You can't say, well, I'll give you an iTunes gift card if you hand over that baby, because no mom's going to do that. You can't say, you better hand over that baby or I'm going to take away your phone this week. Okay, here's my phone. I'm not giving you my baby. And that's the way that people who have true PDA experience it. It's an anxiety-driven response, and the fear is not being in control. People who have a PDA profile will often use social strategies as a part of their avoidance, which means they're skillful. They will often say things like, well, school, it's not really for me. They don't really teach, and they can give good arguments about it. But it really is fueled by their desire to feel in control at all costs. These individuals often have a very high communication ability at a surface level. So they're great, like working the room in the initial conversations, but they have these deeper difficulties with understanding and social interaction. So the deficits are there and they're real, but at a surface level, they will pass as neurotypical people easily. We often will see obsessive behavior. It's often focused on other people or on performance demands. It's about this one teacher who I can't be in the room with because they keep asking me to do things. These individuals often enjoy and are very comfortable in role play and pretend, which a lot of our other autistic folks have a really hard time with. Okay, so it's a very unique profile. As specialists in school avoidance, we see a fair amount of PDA. Um, and some parents, when they learn about this, their reaction, unfortunately, is one of capitulation or giving in, saying that, well, I can't do anything about it. My kid has PDA. So let's talk about, well, let me talk first about what kinds of things people with PDA can have challenges with, and then what can parents do about it. So this is by this woman, Julia, and she has PDA. And so she came up with a list of things, and the people with lived experience are the experts in this. And so there are things like expectations is one that I hear a lot from my people. The constructs, I'm supposed to do it because I'm supposed to do it. Well, why? I have a young woman who has this profile, and she said, if I was born a couple hundred years ago and I had to go out and forage for food to eat, no problem. Like those, what she calls it's the artificial demands. I have to open my mail and I have to take a shower every day. And like these things that I have to do, but they're not kind of biologically programmed. She calls them the artificial demands, are the things that drive her nuts. Um, but things that are more natural are much easier for her. So requests, unwritten expectations, indirect demands. A lot of my PDAers refuse to make promises because if they promise, then they have to, and they don't have agency or autonomy to be able to make their own choice later in that way. Even self-imposed demands can be hard to do these things. So obviously you'll all get a copy of this, but it's really important to know how wide of a spectrum the things that are challenging for PDAers can be in that way. And a lot of the classic things that good parents do, like the equivalent of sticker charts or rewards or inducements to do things, do not work with these kids. Punishments, taking away privileges unless you do this thing, will backfire. So the classic things, and parents struggle raising these kids because what everyone else is doing with their kids, it doesn't work for theirs. It's almost like a kid who has a food allergy. What everybody else can eat that classic FDA healthy food plate, my kid can't. So it's a challenge for parents to say the least. So we often will recommend what we call low demand parenting as an approach that can help these kids to experience less anxiety. What low demand parenting is not, is it's not giving up. It is not permissive parenting, just saying, well, we're going to have a Lord of the Flies environment in my house, I guess, because I can't tell them what to do, so they're just going to do whatever they want. Nope, it's not that at all. It is not giving up your authority as a parent. You still need appropriate boundaries. Kids need firmness and kids need to be contained. Those are all really important things. And having a kid who has this profile who's autistic does not mean that we are giving up on these things. Here are some things. Instead of saying you need to do this way, I wonder if this approach might work. So like you're wondering rather than instructing somebody. Um, One of the things that I will do with my kids, and I see a lot of kids every week with this profile, is I will treat them like co-equals in their own treatment. I might do that with everybody, but much more so and much more overtly. So I will ask them for their opinion, and I'll be curious about what their thoughts are or their problem solving are. It's not just presented in a collaborative way, it is actually being collaborative with them. Um, hmm, I wonder if this might work. Do you want to try it out? We can experiment and see. What are your thoughts about this? So, giving people really the power to have their voice heard and respected, to understand how powerful their drive for autonomy and decision making and control is. And whenever we're able to help them with that. Now, as parents, we learn to pick our battles. And so like, if there are non-essential demands like making your bed every morning, keeping your room, like really clean, like nothing on the floor, like those things that a lot of families will have as rules, they're not essential. They might be the part of the family culture, but they're probably, if you're going to pick your battles, those aren't the ones that, those aren't the hills to die on. And so reducing non-essential demands, knowing that these kids are going to have an allergic reaction to those kinds of things. Mentioning Dr. Donna Henderson again, one of the things that that she told me once is that when you have a kid who is autistic, the burden of change lies with the adults in the room. And so being able to change the environment to better meet their needs, to really understand that they didn't choose to have this nervous system. And so we are not going to have the same expectations that we would for their allistic siblings, or even their autistic siblings who don't have a PDA profile. So these can be really, really helpful things. Now, I mentioned before how I think of these kids as filled sinks if they're going to be overflowing. Well, um, every sink has two drains, the one that we use every day and the one that we're thankful for at the top of the sink if it's about to overflow. And so these are what I call right now skills. If a kid's about to overflow, we want them to be able to drain some water out of the sink. And here are some ways to do that. And a lot of this comes from what I mentioned before, dialectical behavior therapy, or DBT. So the TIP skills, it's an acronym. The T is temperature. The I is intense exercise. I define that for kids in a way where you can't sing if you wanted to while you're doing it. And the P's are paced breathing and progressive muscle relaxation. These are ways to downregulate your nervous system. And people respond to different parts of that. So we have people experiment with that. I find that splashing cold water on our faces is a really helpful thing. Holding an ice cube in your hand for a lot of these kids who are more sensory related can be helpful. But any of these can be useful. The 5, 4, 3, 2, 1. What are 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can smell, 1 thing that you can taste? We're trying to help them to be more grounded, literally, in their current space, to connect with their primary senses and to decrease the attention they're therefore giving to the other things that are making them feel overwhelmed in their environment. I mentioned distraction is a really important thing, like getting them out of that rip current, especially towards a special interest, can be really helpful. And then one of the things that we all do at my center is to really use humor, try and get kids to laugh. And it's technically speaking, it's called inhibitive learning. We're helping them to have a contrary experience to what their fear is or their overwhelm is in that moment. And so I'm always trying to get a kid who is about to overflow to laugh about something in that way. Okay, I'm going to talk about autistic burnout, and then I'm going to open it up for questions for the audience. I can see there's some questions being added in there. Um, Autistic burnout is something that is so important. It is hard to have an autistic nervous system. We know that people who are autistic have a lot of health comorbidities. There's a psychologist, I'm going to be referencing her in a minute, Dr. Megan Anna Neff. She's out in Oregon, and Oregon, and she's also autistic. And she talks about how she loves being autistic, but she hates living in an autistic body. The amount of effort it takes to regulate your nervous system, your sensory system, to deal with all of the allistic demands as an autistic person. And if I talk to my kids who are in this category and I say, what do you wish people know about or knew about you that you don't think they know? By far, the answer is how exhausting it is to be me. I had a girl, I saw her a couple years ago. She's a brilliant kid. She's in high school. She is autistic and school avoidant. She'd missed a lot of school over a lot of years, and she was at a school that didn't really understand her. And we had an IEP meeting. And they said to her, and I understand their point of view, they said, look, when you're here, you do great. You ask insightful questions, you are taking good notes, you do great in the classes. You don't need accommodations, you just need to be here. And so she's smart. And so she said, guys, the mistake that you're making is that you're seeing me run the 100 meter and you're thinking that means I can run the mile, and I can't. I can't keep up that pace for very long. And I find that to be a brilliant description of it. So I like to talk about that. Okay. So when we look at autistic burnout, it looks like depression, but it's actually depletion. They're using the wrong D word. I was in an IEP meeting yesterday, and everyone's saying, "Oh, he's putting his head down in the class. He's giving him, not really doing the work anymore. He looks really depressed." He's not. He's miserable, but it's because he's depleted. And so here are the three things that when we see autistic burnout is what we see. We see exhaustion first and foremost. And it's not just sleepiness. It's just like, too many demands. If you've ever had to make a ton of decisions right in a row, you ever had an awful experience of burying a loved one, you've done nothing physically exerting during the day, but you come home and you've got nothing in the tanks. You're just wiped out. That's the way a lot of these kids are feeling. When people are burning out, they will often have, excuse me, an increase in sensory sensitivity. It bothers them, things that normally won't do. We can all kind of relate to that. Like if we've had a really hard day at work and we come home and there's the dog barking or the baby crying or something, it lands differently when you're exhausted, but it's that on steroids for our autistic kids. And then one of the things that is so important to understand is that when someone is in burnout, their executive functioning skills, like initiation, just craters. And these kids will tell me something, especially my kids who have ADHD as well. We call that AUDHD, so autism plus ADHD. They'll say something almost exactly like this. I can't get myself to do things I don't want to do, even if I know I have to. And so I'll see kids who are like, I can't get myself to do my homework. Unless the homework is really interesting, like it's in line with their special interest. If I don't want to do it, if it doesn't interest me when I'm burned out, I cannot get myself to initiate that activity. Even if I know the consequences are really big and even soon, I still can't get that to happen in that way. So it is so important for this. And many of the kids don't know they're being burned out until they are. I had the experience last week where my wife and I were getting ready to go somewhere in the middle of the morning. And so I had to get a shower and hop in the shower, and I had 30 seconds of hot water. It turns out one of my teenage sons took one of his marathon showers, used up all the hot water. I didn't know it until I tried to take one. And that's the way it is for a lot of these kids is that they don't know there's no hot water in the tank until there's no hot water in the tank. They don't know it's being drained. They don't know how to look for what I call the yellow lights. And all of a sudden they find themselves depleted and they didn't know it was coming. And those around them didn't know it either. So it's one of the core skills we help people to do is to kind of map out their tells. Like what are the things that indicate to the individuals and to those around them that the hot water is being used up and that they're gonna not have any left over pretty soon. And what can we do to do that? Okay. So this is from Dr. Megan Anna Neff. Again, she's the one who's an autistic psychologist. By the way, shout out to her. Her special interest is the dissemination of evidence-based knowledge about autism. She is a national treasure in my mind. Her website is neurodivergentinsights, long one.com, and there's a tremendous amount of resources on there. I've had her come in and train my staff. She and I have collaborated. Every so often I meet someone who I'm like, oh, she has a lot to teach me. She's one of those people. And so what contributes to autistic burnout? Masking, trying to pass as neurotypical, especially the girls. The girls can pass, but it comes at a huge cost in terms of anxiety and depression. Having people minimize their needs because these kids have subtle presentations and people kind of forget that they have an autistic nervous system. And so they are feeling minimized or invalidated when they say they need something. Not having access to appropriate levels of supports and accommodation. This is so, so important. um, having what they call executive functioning fatigue, where you're having to use so much of your frontal lobe trying to decide or initiate or plan or organize, having several stressors happen all at once. And what Dr. Neff says is that when the overall load exceeds abilities plus support equals burnout. And I couldn't agree more with that statement. So when someone's in burnout, what do we do? So access to individual and community support. Um, One of the things that we know that drains these kids is what we call cross neurotype interactions. So autistic folks talking to non-autistic folks. We used to think that people who are autistic have a really hard time putting themselves in someone else's shoes. We call this theory of mind. We now know it's more of a translation challenge, and the arrows go in both directions. It's hard for an autistic person to put themselves in an allistic person's brain, and it's hard for an allistic person to put themselves in an autistic person's brain. And so when we're saying accessing community supports, peer supports, especially connecting with the autistic community, leaning into autistic strengths. They're there. Like, what is someone really good at? How do we give them time off, breaks, time to down regulate their nervous systems? I had one of my autistic young adults went to visit extended family out of town over one of the holidays, and he came back. He's like, it was great because I think they're all like also, in some ways neurotypical. And they said, hey, we're a lot of introverts here, so no expectations to hang out with us. If we're going out somewhere, some of us might say yes, some of us might say no. No pressure on you. If you want to spend time in your room by yourself, don't worry about it because we will too. And he came back saying, it was so validating and so wonderful to know that I wasn't going to offend someone by what appears to an outside person to be withdrawing socially. One of the primary things is reducing load, reducing activities, not asking them to do as much. The middle path is what I call it. Many of these kids are incredibly talented and have all kinds of abilities. And so they're going to want to do so much. I had a college girl last year who decided her first semester to take 8 classes. She made it 6 weeks and then was taking 0 classes. Now she's taking 3 classes. So following the middle path, and she's doing wonderful, by the way. Learning how to self-advocate. And so important, receiving an autism diagnosis, understanding what and how your brain works. What I call it helps getting the owner's manual for your brain, understanding your own triggers. Like I was talking about the yellow lights. What are the patterns that you can identify so you don't get back into the burnout zone later? And then again, engaging with the autistic community. Um, I could talk forever. Let me open it up for questions. This is me, by the way, and if people email me, I will do my very best to get back to you as soon as I can. I am crazy busy right now. The needs in the community, especially in the DC area right now, have never been higher. So we are slammed. But I will get back to you as soon as I can. But let me, with that, open it up for questions from the audience.
Thank you so much. Yes, we've got a lot of questions that have come in. The first being, I know that earlier in your presentation, when you were presenting the slide about atypical anxiety, there were some audio issues. Can you just go back and repeat what you spoke about that, please?
Yeah, sorry about that. So when you have atypical anxiety, that means like a fear of change or sensory experiences, or like, what if things don't go according to plan, not with a bad outcome, but just things not going according to plan by itself. Um, just really helping people to understand that it's not just kind of the what if this bad thing happened, but what if I feel overwhelmed? What if I feel overstimulated in that environment?
Thank you. So is it possible to put your slide up with your contact info again?
Sure. Yep.
Thank
Yep.
you.
Yep. Sorry.
Um, Great. So the first question was, how do you suggest parents communicate to school staff that consequences for sensory overload won't reduce the sensory overload, and is harmful to an autistic child. Do you have resources for parents about that?
Oh, yes. So, thank you for that question because you couldn't be more right about that. So one of the things I was just talking to a school this week about this very same thing, is to give the teachers context and understanding for it. And so part of that's going to be through an IEP process. Obviously, there are rights and privileges, that come to having autism, in that way. There are really great resources on that website, as mentioned, Neurodivergent Insights about those experiences. So there's a packet of things, about that to bring to schools, and to talk about that. But I think part of it is just, communicating directly to the teachers and talking about what sensory overload looks like. That's why I use that slide with the roaches, is because we can all relate to that experience in that way. I will tell you, not every teacher is going to get it. And that's frustrating. I have one of my own kids is autistic, and when he was younger, there were some teachers that just didn't understand it. And so I share your pain on that one. But regular communication, look for the downloads, on that website. There's some great ones on there.
Great. Next question. What if the sensory regulation is so bad that the school cannot accommodate? For example, the student has profound sensitivity to light, sound, smells, and crowds.
So I'll see these cases sometimes. And so when we're talking about like the burden of change lies with the adults in the room, sometimes that also means an alternative placement. Sometimes, like even when there is, like a autism-based program in a comprehensive school environment, a lot of my kids just can't handle that in that way. And so looking at the other alternatives, the other schools, either within the county or private placements, hopefully funded by the county. I know that's an uphill climb. But sometimes if the school cannot meet their needs, the only viable option is to find a school that can. I know that can be a challenge in that way, but they do exist. And there's a lot of idiosyncrasies about which kids' sensory systems and what do we do about it.
Okay. Next is how about breakdowns or meltdowns in autistic children? How do you mitigate those or let them process? Or how do we mitigate those or let them process through it?
Yeah, so I think that probably came in before I got to that part of it on the talk, but really it's about like the riptide. It's about, one of the things I should mention, that think is so important for my autistic kids is relational safety. So having someone that is a safe person at home, who really understands what they're going through as much as someone can in that situation. Like when I work with some of my kids, when they come in, I will not mention anything clinical for the first 3 sessions. We're playing chess, or I'm doing a home visit and we're playing Mario Kart or ping pong or whatever it might be. I'm trying to put money in the bank. I'm trying to build relational safety, and then I can withdraw from it over time. And so, in addition to, helping them lean into into the special interest, and out of whatever they're experiencing is a good thing. And by the way, one of the things that is great for many of these kids is time alone with an animal, a furry animal in particular, that they can pet. I find that that is like an accelerator for being able to come out of a meltdown for a lot of these kids, in that way, but also helping them to know that we are going to, not judge them for it. Because many of my kids, what happens is when they're dysregulated and they're melting down, and then they recover from it, and then comes the guilt and shame, afterwards. And so helping them to understand that we're not saying the behavior is okay, but it's also not a characterological challenge. It's a direct manifestation of their autistic nervous system.
Thank you. So next question, does anxiety sometimes look like hurting someone emotionally, making inappropriate jokes, a devil may care attitude about things that should evoke anxiety even for neurotypicals?
Maybe. I've seen that sometimes where it's like, I'm gonna reject you before you reject me. So certainly that's a part of it. Part of it also is that there is an context blindness, that people are going to act the same way in different environments and not understand how the consequences are different. Like I had a kid that I saw out in the West Coast remotely and kind of autistic adjacent, but autism. And the teacher told him to get off his phone. He gave the teacher the finger, and teacher for some reason didn't like it. I was talking to him. He's like, "Well, she deserved it." And I was like, well, why? And he said, well, because I was done with my seat work. So what does she care if I'm on my phone? Like, well, it's the rules. And it occurred to me that if the teacher leaves the room to go to the bathroom and someone pulls out their phone and another kid says, hey, get off your phone, you're probably going to give them the finger if you're 16, right? And so he couldn't see authority. He couldn't see the context to it. And he was saying very much like, well, they just deserved it in that way. So I do see that sometimes too, where it's more of a difficulty recognizing the social capital that's being expended by some of those things as well.
Okay, the next question asks, how much of this discussion overlaps with a child diagnosed with ADHD, presuming no co-diagnosis of ASD?
So part of it does. And so ADHD is an impulse control disorder at its primary. It's not an also ran in the race. It is often a primary challenge for a lot of these individuals. The way that I think it most relates is the exhaustion, how hard it is to stay current with the work, being able to feel competent, because it's harder. It can also lead to social challenges. We know that a lot of people with ADHD deal with difficult social situations because their self-censor doesn't work very well in that way. Where it deviates is with the sensory aspects, and of course other parts of it. There's not going to be the same special interests, the same, there are important differences, but important similarities throughout it as well. Mostly with difficulties with socially and academics and feeling overwhelmed and overloaded. And between 40 and 60% of kids with ADHD will have an anxiety disorder as well.
So the next question is there a way to decrease sensory sensitivity, increase tolerance to sensory input? My incredibly smart 2E autistic son is so sensitive to all sensory input that functioning in the school environment became so difficult that he dropped out of school.
I'm sorry to hear that. Yes, I mean, it's a process. So sometimes getting somebody into OT is a really important way to increase the ability to handle that. My dog is barking, I apologize. But being able to handle, like gradually increasing sensitivity. One of the tricks that I've learned works for some kids is when you frame it as a challenge. I wonder if you'll be able to do this for whatever amount of time they could do it for. And so there's just something qualitatively different that I've noticed among many of my autistic kids who have these different sensory sensitivities. If they are challenged to do it with like one toe out of their comfort zone and understanding that they can become more tolerant of it in that way. Um, and at the same time, using the decibel reducer, using the sunglasses, having some kind of a sensory regulation thing. Like I have a kid who uses salt, and so he'll dip a lollipop into a salt container he carries with him, and that startle reflex kind of re-regulates his sensory system in that way. So I think there are ways to do it, but I'm sorry that your son dropped out when he seems so brilliant.
Thank you. So next question asks, if a therapist recommends consequences for an autistic child having sensory overload, do you recommend trying to educate the therapist or find a new therapist?
It's a great question. I guess it depends on the therapist themselves and how much they're understanding it. In our practice in the last 5 years, we've done a deep dive. Almost all of our internal lunch and learns are about autism. I'm trying to get everybody to the state-of-the-art knowledge about it in that way. It's a climb. It's not an automatic thing where someone reads a book and then says, "Oh, I get it now," in that way. Um, and it's hard for me to speak on an individual basis about that. But I also have learned to trust parent judgment. And if it doesn't seem like it's a good fit, it's probably not.
Great. Um, is there a parent training focused on anxiety and autism and PDA? Does your practice offer parent therapy to support a child who doesn't want to go to therapy and the parent needs help?
Yeah, we do that all the time in our practice. There is an evidence-based anxiety program for parents called SPACE out of Yale. My colleague Ellie Leibovitz developed it. I'm a huge fan of Ellie and of SPACE. When I was asking him, well, what do you do if there's an autistic kid? He's like, well, that's a little bit different. And so you need to find somebody who has expertise in the intersection of anxiety and autism. And a lot of these kids don't want to come in. Like I had a kid who wouldn't come in to see me, wouldn't go to school, wouldn't take meds. So I started doing home visits and we had play dates. He's like, "You want to play in the backyard?" I was like, "Yes, I do." And he taught me how to shoot arrows. I got one of them lodged in their fence. I wasn't very good at it. But those kinds of things too, like, not taking no for an answer and doing home visits and just not talking about therapy. Let me meet your dog. Let me meet your cat. I bring in my dog to the office a lot as bait to help the kids come in that way. But yes, parent training, individualized parent coaching for anxious autistic kids is absolutely essential.
The child has many characteristics of autism and the parent suspects autism. What should be the first step?
A formal evaluation. So, an evidence-based evaluation, you're going to be using the acronym is called an ADOS, ADOS, or the MIGDOS, in the context of a comprehensive psychological evaluation, is a really important thing. I will tell you that they often have long waiting lists. We began doing it at our office last summer. We hired some expert evaluators because the waiting lists at places like Kennedy Krieger and Children's Hospital were literally 18 months to 24 months long. And the gift of a diagnosis is so critically important. And so that's why we began doing it, because it's so important. And there's just the waiting lists are so prohibitively long in a lot of practices. So really pursuing an evidence-based comprehensive evaluation that includes those measures in the evaluation is really important.
For English language learners, how can language learning and navigating multiple languages throughout the day impact a child's cognitive overload? How can we help them maintain their home language and learn English without overloading them?
What a wonderful question. What I would say to this, I don't know the science behind this, but I'm very confident that it's going to increase the exhaustion and the burnout vulnerability. Because I know if I'm taking a class and the teacher has a strong accent, it takes so much more effort for me to listen and to absorb the information. And that's one teacher out of a day. If it is everybody, and we're trying to learn a brand new language ourselves, so it's not just like being able to interpret, but speak it in that way. I would think that lowering the load in other areas of someone's life, like giving them more downtime, acknowledging that this is really hard for them. I also think it matters on how old they are. So we know that kids who are younger have an easier ability to acquire language than kids who are older. So I don't know the age of this child, but the younger, the better in terms of burnout vulnerability. But I would think that just helping them to have more downtime, more time to self-regulate, and kind of really working with the school to teach them about like what are some indicators that he might be or she might be being overloaded in that situation.
One of the biggest challenges with my PDAer and school is lack of respect for the hierarchy of school. It has been discussed multiple times in IEP meetings, but many educators struggle to understand this and take offense when my son talks to them as an equal. Is there anything you recommend to help them better understand why this is difficult for some autistics and how to improve their relationship with them?
So the way I describe this is, let's say you have a kid who's colorblind and they keep wearing mismatched socks. It's not because they're intending to, it's they can't see. They literally can't see the difference. Authority, hierarchy is a social construct. It's not observable. You don't know what color it is. You don't know what it feels like. And if you're autistic, those things are invisible to you. And so helping the teacher to understand context blindness specifically. And I use the analogy of color blindness, that they are not going to be able to see the authority, and they're going to talk to you in the same way they're going to talk to their friend on on the playground. And it's not at all an indictment of their character. It is a manifestation of their disability. And so, like in for my kids, like they don't call me doctor, they call me Dalton, and I do that very intentionally for this very reason, is if I am seen as the authority and the doctor, then it's almost like there's this power differential that they can't see. And if I'm more of a co-collaborator in that way. So I guess next question.
Okay. So, can OT work on sensory issues, work in conjunction with treatment of anxiety, or can OT address any of the issues with anxiety?
Yeah, so we will often co-treat and we'll often recommend an OT referral for autistic kids to help them to learn how to downregulate their sensory sensitivities in those ways. And yes, I mean, we focus on a lot of the anxiety part of it, but if the anxiety is rightfully about overstimulation from a sensory standpoint, a referral for OT makes a ton of sense. And we have OTs come and give us talks about what they do so we can better understand that. And we collaborate with them and we'll kind of figure out how to work collaboratively in exactly that way. So to the answer to that one is a resounding yes.
Thank you. You have used allergic metaphor a few times. Do you have advice for supporting an autistic child, low support or level 1, who will be undergoing oral immunotherapy for severe food allergies? The goal is ultimately to reduce risk, but how can we address both dread and anxiety due to discomfort and risks of allergen exposure in the moment to deal with the avoidance of doses that must be taken on schedule?
So that one, I'm going to say getting individual support from a professional would be the way to go for that. One of the things that, like, we used to arm wrestle over the specific phobias because they're so wonderful to treat and so effective in short term. You get a kid who is autistic and has a blood injection injury, like a needle phobia. My heavens, those can be incredibly challenging because of the sensory active aspect to those things. And so for immunotherapy like that, that involves sensory things, I think that getting someone who has expertise in anxiety and autism on the team would be a really important thing rather than me shooting off the cuff with a specific recommendation. I think that one warrants more care and more specificity by a trained expert.
Hey, how do you help someone create a new map for a new situation or experience, like taking a class at a new school or college?
Rehearsing it is what I would do. So helping them to kind of so if there's a new class in college, like a lot of my autistic kids, I'm like, all right, we are going to do we're gonna have a session at Montgomery College, and we're gonna walk around the campus, and we're gonna go figure out where the classes are. And we're going to help you to understand like how to get from one class to another. We're going to also talk to the support staff and how do they help an autistic person in that way. A lot of colleges in the area, George Mason, Maryland, many American, have specialized programs for autistic students, which I think is really, really important as well. So rather than helping them to cope with not having a script, and that's part of it. Part of it is how do we help them to obtain one, and how do we give them like a decision tree if things go off plan, if this, then that kind of an approach can be really helpful.
Okay. I have a high masking 10-year-old son with um, ADHD. He has struggled with school avoidance on and off for all of his school years. Of course, it gets worse at the end of the year. His school team does not see his ASD. How can I create accommodations for him in our home? And how do I advocate for him with this school?
Um, so a lot of these questions are really specific, and I want to stay in my lane in terms of like ethical boundaries of making recommendations without ever meeting the child. But I think education, education, education. So if they don't recognize the autism, hopefully there's been an official diagnosis and an IEP or at least a 504 plan. I think that it's very idiosyncratic about how we accommodate them at home. It depends on kind of which things are challenging for a kid in that way. But part of it is just a ton of patience and really helping to get a perspective to the school that this is a kid whose absences are not willful disrespect. It's not a kid who is, playing hooky and being truant. Every kid is as successful as they know how to be with the knowledge and skills they currently possess in the environments they're placed in. And so I think this is one of those situations when we're talking about school accommodation is strong advocacy and education for the education team itself about not just autism, but about your child's experience of autism is going to be important. I know there are so many questions. I'm pulling it up here. Oh my Lord, so many. And I wish we could talk for another couple hours on these kinds of things.
Well, thank you so much for being here today, and thanks to all those on the call. We appreciate you and have a great Friday, everyone.
Thank you, everybody.